All right, so this is the last video for the blood vessels chapter. We are going to start off with this chapter talking about shock. And so there are many types of shock. We're going to talk about them. But in general, shock just refers to the fact that there is inadequate blood being circulated. Okay, and so there are many causes for this. But there's just not enough blood to circulate and get it to the tissues. That is shock. Okay, so let's talk about our first type. That's going to be hypovolemic shock. All right, so this would be from blood or fluid loss. All right, so blood or fluid loss. And so there's a dramatic decrease in blood volume with hypovolemic, right? Volemic meaning volume, shock. Okay, so this could be hemorrhaging from maybe like there's some internal bleeding. Maybe there was like a car accident and somebody has damage to the internal organs. There's internal hemorrhaging, or there's some sort of wound and they're bleeding from that and losing blood that way. It also could just be from fluid loss, from very, very severe vomiting or diarrhea, okay? So this can decrease the blood volume, and if there's not enough blood in the vessels, then you're not gonna get enough blood to the tissues, okay? And this could also be a major concern with victims of severe burns, third-degree burns, because the skin is not there to keep that fluid in, and so you lose fluids very easily with severe burns. Okay, so that's hypovolemic shock. And then there's cardiogenic shock. Cardiogenic shock is related to the heart, right? So the heart isn't pumping very well, right? So it cannot create enough pressure. All right, so this could be like heart failure. Okay. And so it's not creating enough pressure to move blood through the blood vessels to the tissues. Okay, so that's cardiogenic shock. And then we have anaphylactic shock, which I'm sure you've all heard of. All right, this comes from systemic. All right, so systemic meaning all over the body, all right, as opposed to local, meaning in a specific area. So systemic, this is happening everywhere in the body. Vasodilation. All right, so all over your body, your blood vessels dilate. That will cause your blood pressure to drop dramatically. All right, so this will cause a huge drop in blood pressure. Okay, and so when the blood pressure is that low, you can't move the blood efficiently through your body. So frequently, anaphylactic shock, you hear about it with like allergic reactions, and that's because with a severe allergic reaction, you get that systemic release of histamine, and then that histamine causes systemic vasodilation and that drop in blood pressure. Okay, so that's anaphylactic shock. And then there's neurogenic shock. All right, so with neurogenic shock, this involves a loss of sympathetic nervous system function. All right. Sympathetic nervous system function. And so there's a couple ways this could happen. So it can be caused by severe trauma. And for example, like spinal cord damage, something like that could cause this loss of sympathetic nervous system function. There are also some medications that can cause this issue. All right, and so remember, our sympathetic nervous system helps to constrict those blood vessels, all right, to help maintain that blood pressure at the higher level. So if you don't have that input, likely your blood pressure is going to get too low, okay? And then one other thing that can happen is with like an epidural, if that's improperly administered, all right, so improper administration of anesthesia to the spinal cord can cause that problem, that loss of function to the sympathetic nervous system. All right, so anesthesia. Okay. All right, so that is neurogenic shock. And then we have obstructive shock. So obstructive, think of an obstruction, right? Because that's exactly what's going on. And with obstructive shock, a blood vessel is blocked. Okay? And so an example of this would be like a pulmonary embolism, right? Or just any kind of embolism, depending on where it lands. All right, so an embolism, a clot, can cause obstructive shock. So you're actually blocking the blood flow, and so blood isn't getting to the tissues. Okay? And then our last type is septic shock. All right, so septic shock results from an infection that actually gets into the blood, right? So this would be a systemic, right? Meaning it's in the blood and now it's throughout the body, infection. Okay, and so that systemic infection causes release of inflammatory chemicals, right? So it causes an inflammatory response. And so that also would be systemic. So similar to anaphylactic shock, you have this inflammation, systemic inflammation that causes the blood vessels to dilate and that big drop in blood pressure. All right, so that would be septic shock. So the cause is just different because this would be an infection in the blood leading to the inflammation. All right, so let's talk about the stages of shock. Okay, so with shock, there are 3 different stages. The first one is compensated. So someone's going into shock, but immediately their nervous system, their sympathetic nervous system responds, all right, and it kind of helps to compensate. That's why this is called compensated for the problems, all right? So that sympathetic nervous system is going to increase blood pressure. That person is going to have tachycardia, all right? So an increase in heart rate, tachycardia. They would be sweating. Likely they'd be very pale, have a decrease in urine production, all right, and their pH can drop, their blood pH, which also is very, very dangerous, all right? So in a patient that is compensating, this is kind of the general symptoms you'll see. So that's the first stage of shock. Eventually, the sympathetic nervous system can't keep up with whatever the issue is. And so that sympathetic nervous system gives way. That's where the patient will decompensate, and you'll see you kind of lose all those effects from the sympathetic nervous system. You'll have a decrease in blood pressure and heart rate. All right, and so if that decompensated state it continues for a while, you'll end up with this third and final stage, which is irreversible. So where you have organ damage, all right? And so this would be from the lack of oxygen to those tissues. Okay? All right, so that's shock. So now we're going to talk about capillary exchange, all right? So in the capillaries, how are, particularly we're going to focus on fluids exchanged, all right? So let's review a couple of terms you've learned so far. So the first one is diffusion, okay? So you hopefully learned that diffusion is the movement of something from high to low concentration, all right? So with skeletal muscle, right? When you're activating that skeletal muscle, the sodium ions are going to move from the high concentration on the outside of the cell during an action potential towards the inside of the cell. That's diffusion. And specifically, that would be an example of facilitated diffusion because that involves a membrane protein for that sodium to move through. All right, so we're still moving from high to low concentration, but with facilitated diffusion, you're facilitating diffusion by adding a protein. Okay. All right, so that's diffusion, high to low concentration, and then we have filtration. So filtration, or sometimes called bulk flow, is moving from high to low pressure. And so this is what we're going to be looking at here in the capillaries. Okay, so fluids are going to move from areas of higher pressure to areas of lower pressure. All right, and so there's two pressures we're going to be talking about. The first one is hydrostatic pressure. All right, this is going to be the pressure of the fluid on the walls of the vessel. Essentially, this is blood pressure. All right, so just pushing out on the walls of the blood vessel. Okay, and so that's hydrostatic pressure. And remember, that decreases as we go from arterial to venule. And so that is going to be pushing fluid out, right? That's going to be our kind of filtration force out of the capillary. Okay, then we have osmotic pressure. This is the pressure pulling water into the blood vessel. So specifically, osmotic means we're pulling water in. Okay, and this is going to be associated with that plasma protein, albumin. Remember, albumin is like a sponge, always sucking water towards itself, and that albumin is going to be in the blood. All right, and so that is going to be a constant pressure of about 25 millimeters of mercury. All right, so that's constant at 25 millimeters of mercury. Okay, and so what I have here, I have this example of like a little capillary. We have the arterial side here, and we have the venous side here. And so we have these A's are our albumins, and so they are going to be pulling in water, all right, at a pressure of 25 millimeters of mercury. Okay, so that's our force pulling in. And so then we have our hydrostatic pressures, remember, pushing out, and they differ on the arterial versus the venous side. And so on the arterial side, we'll say it's about 35 millimeters of mercury pushing out. And on the venous side, we have about 15 millimeters of mercury pushing out. Okay? So what we want to figure out is, what is the net pressure? Is there more pressure pushing out, or is there more pressure pulling fluid in? Okay, so let's look. And so remember that osmotic pressure is the same throughout the entire vessel. It's just the hydrostatic pressure that's different on the arterial side versus the venous side. Okay, so let's look at our net. Okay, so on our arterial side, we have 35 millimeters of mercury pushing out. We have 25 pushing in. So that would give us a net of 10 millimeters of mercury pushing out. Okay? Hopefully you see that, all right? We would just subtract. So you just do 35 minus 25. And so the 35 is higher, so that means that we're going to be pushing out more than we're going to be pulling in. All right? So then on the venous side, we're going to be, actually, let's change this really quick just to make sure our math works out. Let's do 17 for this one. Okay, so on our venous side, we have 17 pushing out, and we have 25 still for that osmotic pressure pulling in. Okay, so if we do 25, right, minus 17, that will give us 8 millimeters of mercury in, all right, because that osmotic pressure pulling water in is higher than the hydrostatic pressure pushing out. So we're going to have more fluid being pulled in on the venous side than more is being pushed out on the arterial side. Okay, And so if we look at that, right, what's the difference between these two? So on the arterial end, we have 10 millimeters of mercury being pushed out. We have 8 millimeters of mercury being pulled in on the venous side. So the net is going to be 2, right? That's the difference, millimeters of mercury. All right, and we're pushing more fluid out than we're pulling in. Okay, so we're pushing more out, 2 more than we're pulling in. So then that would be 2 millimeters of mercury out. That is our net, okay? So we're gonna be losing fluid through our capillaries, all right? So this is kind of a very typical example of a capillary and what's going on, okay? And so with that, let me try to get this centered again, okay? With that, we have interstitial fluid that ends up forming outside of the capillaries and kind of around the tissue cells, all right? And so this is the fluid that leaks from the capillary. All right, so typically it's going to be the fluid found like around the tissues. Okay. All right, and that's because the hydrostatic pressure on the arterial end is higher than that osmotic pressure. Okay, and so you should be kind of familiar with and understand that concept and why we end up with this interstitial fluid. Okay, so let's talk about what happens with this interstitial fluid. So we're just going to very briefly talk about this because we do have a lymphatic chapter. So we're just going to touch on this for a moment as it relates to what we were just talking about. Okay, so lymphatic vessels, their job is to remove that interstitial fluid that was just created. Okay, and so they're going to be located near all capillary beds because that formation of interstitial fluid is very typical with a capillary bed. And so these vessels are going to remove that interstitial fluid. Okay, so we'll learn all about these vessels and how they do that. But they function a lot like veins. Okay, so movement of lymph. So lymph is that fluid that they're collecting, that interstitial fluid. And so that lymph is going to move through these vessels, and these vessels have valves, right? So they have these little valves, just like veins, that are going to keep that lymph from moving backwards. So that lymph will actually, that interstitial fluid will actually kind of squeeze through like that the cells, right? The squamous cells, because with lymph vessels, they're kind of like overlapping like this. And so there's these little gaps, right, like little trap doors that interstitial fluid can push on to get into the lymph vessel. So they'll do that, the fluid will, and it will just move through this vessel past those valves. The valves will prevent that lymph from moving backwards, all right? And these lymph vessels also rely on skeletal muscle milking, all right? So that's why if you stand on your feet for a lot, right? Maybe you're not walking around, you're just standing, for work or something. You might experience edema or swelling of your feet, and that's because that fluid is accumulating in your lower extremities, and if you're not walking around, you don't have that skeletal muscle milking to help move that fluid upwards towards the subclavian vein where it's added to the blood. Okay, so they also rely on skeletal muscle milking and inspiration, right? So breathing and creating that negative pressure. So movement of lymph through a lymph vessel is very much the same as movement of blood through a vein. Okay? All right, so we'll talk more about those lymph vessels when we do our lymphatic system chapter. But now let's talk about edema. So edema is when there's an increase in interstitial fluid. So let's talk about a few things that can cause edema. All right, so one thing that can cause edema is if there is a high venous pressure. All right, so if we go back up here, right, so if we increase the pressure on this side, all right, we're going to kind of start tipping this balance, right? So if we moved this, maybe I'll do this in like a different color, right? So if we bumped this up to, let's say 20, right, millimeters of mercury. So we're increasing the venous pressure. So then this would only be 5 millimeters of mercury. All right. Then that means this would become 5. So we're going to increase that amount of interstitial fluid we're making. So that could lead to an increase in interstitial fluid in general. Okay. So that's what I mean by high venous pressure. So we increase the pressure on this venous side. All right. So that can definitely lead to edema. And so that can result from, if there's not enough skeletal muscle milking for the veins, right, to move that venous blood, that will increase the pressure on the venous side. If you maybe have like a valve problem, so those valves in your veins are incompetent, that could increase the pressure on the venous side as well. Okay. All right, so edema could also be caused by a loss of albumin. So then that means that osmotic pressure, where it's normally constant at 25, it becomes lower, all right? And so then you'll end up having more interstitial fluid being produced. And so this can be seen frequently with kidney disease, okay? Because the kidney's job is to filter blood to make urine. And so they have, think of it like a colander, right, or a sieve with very fine openings, but those openings are too small for albumin to fit through. However, in a kidney that's diseased, those openings kind of tear and become damaged and become much bigger. And so that albumin can be lost in the urine. All right. And so that could cause edema as well. Okay, so then edema can also result from an increase in permeability of a capillary. So that capillary becomes, right, leaky. So if we have a leaky capillary, that could definitely lead to edema. So it's just much easier for fluids to get out of the capillary. That would be a problem. And so this is seen a lot of times with sepsis. All right, capillaries become more leaky, resulting from sepsis. Okay, and then lastly, lymph blockage could cause edema. So the lymph vessels aren't as able to take up that lymph and put it back into the blood. And one thing that can cause this, which is kind of like horrifying, is a parasitic worm. All right, so there are parasitic worms that are small enough to get into those lymph vessels and just physically block them. And you can also see this lymph blockage causing edema resulting from breast cancer, because frequently with breast cancer, lymph nodes are removed from like the armpit area, and that will disrupt the flow because those lymph nodes are connected to lymph vessels, and that'll disrupt the flow of lymph coming from the arm. So you can see a lot of swelling in the hands and that kind of thing. All right. So this would be from lymph node removal. All right. Okay. So that's edema, all right? So our last topic is just to talk about a couple of special case circulations, all right? So there are special circulations in the body. The first two we have already talked about in detail when we did the heart. So the pulmonary circulation, just as a reminder, starts in that right ventricle. That right ventricle is going to contract. It's going to push blood out of that the pulmonary trunk, all right? It's going to move to the right and the left pulmonary arteries, to the lungs, where it will go through capillaries. There's going to be capillaries of the lungs. and then it will pick up oxygen in that blood. Then the blood will be brought back through the pulmonary veins, and that pulmonary circulation will end in the left atrium. Okay? And then we have the systemic circulation, which starts in the left ventricle as it pumps blood out through the aorta, and then that will go through the capillaries that are in the tissues. All right. And then once that blood is returned to the heart through all the veins in the superior and inferior vena cava, it will end that systemic circulation in the right atrium. Okay, so we already talked about those previously. All right, so these next few, though, you probably may not have heard of. And so the first one is the circle of Willis. All right, so the circle of Willis is this collateral source of blood flow to the brain. So it's like a backup system of blood flow to the brain. And so it forms this like circle structure, right, like this, around the pituitary gland. Okay, and so this blood is coming from, let's talk about the vessels. All right, so we have anteriorly, blood is being provided from the internal carotid arteries. All right, so the internal carotids, that's going to be the right and the left. So that would be, let's just say these guys. Okay, so that's the anterior. And then posteriorly, we're going to have blood coming from the vertebral arteries. All right, so then we would have a right and a left vertebral arteries. So those are going to come up to the brain through those vertebrae, right? So remember the transverse foramen on the vertebrae, the cervical vertebrae, those vertebral arteries are going to move up through that. Okay, and so they provide like a backup circulation for blood to the brain because it is so important that the brain has oxygen and nutrients. Okay, all right. And then our last special circulation is fetal circulation. Okay, and so the important thing to remember with fetal circulation is the mom is supplying the baby with the nutrients and the oxygen it needs. And so within that fetus, we're going to bypass the lungs because that baby is not needing to breathe oxygen, right, to oxygenate blood. So first of all, in the umbilical cord, you have an umbilical vein, all right? And so this is another example of a vein that is going to be red because it has oxygenated blood, and an artery that is going to be blue because it has deoxygenated blood. So the umbilical vein is going to contain oxygenated blood, and it's going to take that blood towards the baby's heart. All right, so that's why it's called a vein, right? Because veins take blood to the heart. This blood is oxygenated though, so it's coming from mom going to the baby's heart. And then you have an umbilical artery, which is going to take that deoxygenated blood, right? So DO2 blood away from the baby's heart. All right, and that would go back into the mother's circulatory system. Okay. And so then within the baby's heart, there are also some special structures that are really cool. So within the baby's heart, there is a foramen, all right, so a hole between the right and the left ventricle, right? So it's going to connect the right and left, not ventricles, I'm sorry, atrium. All right, so it connects the right atrium to the left atrium, okay? And so this is going to be a way to bypass that pulmonary circulation. So blood can just move directly from the right atrium over to the left atrium, okay? So both of these structures we're going to talk about are going to bypass that pulmonary circulation because that baby doesn't need to send blood to the lungs because it's getting its oxygenated blood from mom. Okay, so the foramen ovale is going to connect the atria. All right, once the baby is born, a little time after the baby is born, that hole closes and it just becomes kind of an indentation that's called the fossa ovalis. So in adults, there is a fossa ovalis. It's kind of the remnant of that foramen ovale. Okay, and then there's the ductus arteriosus. All right, in adults, that becomes the ligamentum arteriosum. And so what this does is it's actually a kind of like a little tube that connects, right, a little duct that connects the pulmonary trunk and the aorta. All right, so then blood, instead of going through the pulmonary trunk to the lungs, it can just bypass straight to the aorta and go out to the tissues. Okay, so those are the special circulations in the fetus. All right, so that's it for our blood vessel chapter. All right, so the next chapter we'll be doing will be the respiratory system.